Hi friends, today Jeevita is here with us again to give us a lot of insights about ORE yet again. So last time we learned about the part one of ORE exams, where we elaborated on how to apply, how to prepare for it, how long you need to prepare for it, and how do we know that we passed, and all the details about part one. Now today we're going to talk about part two. So Jeevita, when exactly do we apply for part two? Is it immediately after part one, or is there a cool off period for it?
Yes, so after you clear part one, you are added to the part two list, candidate list, and you are eligible for booking right after.
Okay. So even the next day I can apply if the exam's happening.
If the exam booking is open, yes, you can. Yes.
So how many times in a year does this part two exam happen?
It's conducted 3 to 4 times a year.
3 to 4 times a year, okay. And how many days before the exam would I be intimated about the dates? The booking, when would it open?
The booking is usually open 2 months prior to the exam date.
All right. Would you say 2 months is a good enough time to prepare for part two?
No, unfortunately. You need at least good 6 months to prepare for part two.
6 months, all right.
So yeah, you start preparing.
Okay.
Sorry. So you start preparing. Once you feel confident, you can go ahead and book the exam.
So once you clear part one, it's safe to wait for 6 months, prepare yourself well, and meanwhile, when the booking opens during the end of that 6 months, it's better to book that time, right?
Yes. Unless you're confident with your clinical skills, you can go ahead and book. Yeah.
Right. And how many hours a day do you think you need to prepare for part two?
So for part two, there are 4 components, and you'll have to practice every component every day. So that's about 8 hours a day again.
8 hours a day. Okay, that's quite a stretch. So 6 months for 8 hours a day is what you recommend?
Yes.
Oh, wow. Okay. That's good. So now you told me there are 4 parts. So let's talk about the parts of part 2, because in part 1, we just had a theory component. It was pretty simple to understand. So part 2, you're telling me there are 4 parts. Can you tell me what are the 4 parts?
Right. So we have OSCE, medical emergencies, mannequin, and DTP. That's diagnosis and treatment planning.
Diagnosis and treatment planning. Okay. So when there are 4 components for part 2, I would assume it happens on 4 different days?
It happens on 3 days.
Okay. So what do we expect on each of these days?
First day is OSCE. The day 2 is mannequin. The third day is DTP and medical emergency.
Okay. So DTP and medical emergency happens on the same day, on the third day. Right.
That's right.
Can you take us through each of the days? So OSCE happens on day 1, and do you have to sit throughout the day for the OSCE? Does it happen for 6 to 7 hours, or how long are they going to examine you for?
Right. So OSCE is an objective structured clinical examination. Okay. It is a 2.5 hours exam.
Okay.
So basically,
2.5 hours. All right.
Yes.
So just for 2.5 hours. And what about medical emergency? How the mannequin part, the day 2, does that happen for the entire day, or that also happens for 2 or 3 hours?
It's 3 hours.
3 hours. And what about the DTP and medical emergency part?
DTP is 54 minutes to 1 hour, and medical emergency is about 13 minutes.
30 minutes.
13.
13. Okay, that's being
13
very
to
specific.
16 minutes. That's it. Yeah.
Okay, great. So we'll talk about the day 2 and day 3 in our next video. Today, we'll focus on OSCE. So you told me OSCE means objective, structured clinical examination. Could you tell us more about it, Jivita?
Right. So basically, OSCE is a single continuous session for 2.5 hours where they have series of stations. Each station is for 5 minutes long, and you get 1 minute to read the question. So you total 6 minutes. So you get to read the question, and then you perform or answer in 5 minutes, and then you move on to the next station. So you have a total of 24 stations, out of which 15 are active stations, and the remaining are pilot and rest stations.
Sorry, they are pilot.
Pilot or rest stations.
Okay. So what does active station mean?
So active stations are the stations for which you'll be marked. The pilot stations are just for pilot exercises for future exams. So you're not going to be marked for them.
Okay, you said active stations. Okay, so pilot stations, you don't get marked. And active stations is where you'll be marked. So that's just 15, 1-5. So effectively, although there are 24 stations, only 15 will determine whether you pass or fail.
That's right.
Okay, great. Okay, let's talk about these 15 important stations, which are called active stations.
Right. So in active stations, you can have actor OSCE, skilled OSCE, or written OSCE.
What are they?
So the actor OSCE is where OSCE station is where you'll have a clinical scenario. There's an actor patient inside. You probably have to take a case history or explain a certain procedure, extraction, sedation, and you read the question, what's outside, enter, and then you perform, and for which you'll be marked. The marking system is for your clinical knowledge, your professionalism, communication, leadership, and management.
Oh, wow. So you're going to exhibit all that in the actor station.
That's right.
And how many minutes do we get for this station, the actor station?
5 minutes. Every station is for 5 minutes long for performing or answering. Yeah.
Okay. And in this 5 minutes, generally the actor stations, I would presume that you would have to elicit a case history, talk to the patient about the tentative diagnosis and treatment plan as well. Is that what we're looking at?
Yes, depends on what they want you to do. It could be even a scenario like your nurse is drunk and what you're going to do, or you've extracted the wrong tooth, how you're going to manage.
Okay.
Yes.
They are pretty difficult clinical scenarios, man. Okay. So I think this needs some sort of guidance and preparation. All right. Now let's move on to the next type of active station. It's called skill station, is it?
Skilled OSCE, that's right.
All right. So what are these skill OSCEs all about?
Skilled OSCE stations are where they ask you to perform, place sutures, placing rubber dam, taking x-rays.
Okay.
Yeah.
So it's basically a procedure, a clinical procedure.
Yes.
So they're going to have a live patient on which you're going to do a rubber dam, or it's going to be a mock,
a
like
mannequin.
a simulated.
Yes.
A mannequin, probably.
Yes.
Okay.
Yes.
All right. Great. That sounds pretty straightforward. I think most of us can manage. What about the third type of active station, the written station? What do we do there?
So written stations, they'll, to give you an example, you could have a mixed condition x-ray and they can ask you to predict the age of the patient and see what abnormality is visible on the x-ray.
Okay.
So those kind of things that you can do.
So again, probably a clinical case record, and
yes,
they would expect you to do again diagnosis and treatment planning.
Yeah, it could be a referral letter.
All right,
it could be an audit, radiograph audit. So
all right.
Yeah.
Oh, interesting. So here you go and write down in your own words.
Yes, you'll have to write. Yes.
In something like a short essay sort of thing.
Yeah, a lengthy one.
A lengthy
5
one.
minutes is never enough. Yes.
Okay. 5 minutes is never enough. So you got to write really fast. Like
Yes.
it's they give you an A4 empty A4 size paper and you got to write down.
Yes.
All right. Got it.
Yes.
Superb. So I think I have a clear picture of what active stations are. Can you tell me about the pilot stations?
So pilot stations are basically pilot exercises. These are for the future exams. So it could be a situation where it's never, you can never tell which one's a pilot station unless you've actually, only when you prepare for this exam, you'll be able to tell which one's a pilot and which one's not. In most scenarios, you can't even, okay, I don't know what I'm saying. I'm sorry, you're going to have to edit this.
That's okay.
Pilot stations, yeah, you will not know until the end of the exam which one is pilot and which is active. Yes. Okay.
And
so it's best if you perform like it's an active station.
Like an active station. Okay. Got it. So we can expect 1 or 2 pilot stations in the exam, or more than that?
3 pilot stations. The most usually 3 pilot stations. Yeah.
Okay.
And rest of them are rest stations.
Okay.
So it's basically a break. So you just sit,
okay,
have a drink, not have some water, basically.
Okay.
Yeah, sometimes they give you biscuits. That's it.
Yeah, I know, because I think 2.5 hours is quite a long time, no? I'm sure it drains you out.
It is. It's a very exhausting.
I just have one small doubt with the active station. Will there be an examiner sitting in the station evaluating how you speak, or is it recorded on camera?
There'll be an examiner sitting inside. You don't interact with the examiner. It's just with the patient. Just ignore the examiner and
you gotta ignore him. Okay, great.
Yeah, unless it's just the examiner and you need to answer to the examiner. Like if it's to give oral hygiene instructions, and you don't. In most cases there will not be an actor. It's just an examiner. So you just go and talk to him.
You talk to him. Okay. So if there's an examiner alone, then you can talk to him. That's fine.
Yes.
Right. Okay. So I think I've pretty much understood the system by which OSCE works. Can you tell me the system which they use to give you marks or evaluate you for the OSCE exams?
Right. So they basically do the 4 grading system. You need to get exceeding standards or meet standards to clear. Below standards or does not meet standards is a fail.
Okay. So basically, it's like a 4-point grading system, like good, moderate, bad, very bad, something like that.
Yes, something like that. So we want exceeding or meet standards. Below and
so
fail is
either number 3 or number 4. So the passing mark is like 3. That's like the bare minimum that you got to get.
Yes.
And so they score out of 4 for all the 15 stations, 15 active stations. Yes. And then they probably average it out.
No, you need to. This marking system, I don't think anybody's understood this clearly, because it depends. You could have, you would have done everything right, but you could have still failed the exam because you probably were not behaving professionally.
Oh.
So okay. Yeah, or you have missed the major part, but you still pass the exam if you've conducted yourself well.
Oh.
So yeah.
So apart from
they say you need to pass at least in 4 active stations. Sorry, you can fail up to 4 active stations and still pass the overall exam. There is no average system. So for each station has been marked.
Okay. So in your result letter, do you actually get marks for this? Like 50 out of 100 or 60 out of 100? Do they give it like marks for OSCEs? No.
To be honest, the email that you receive saying that you pass will have nothing but you've been successful and you've cleared part 2. That's it.
Are you serious? They don't even tell you whether you passed in OSCE, mannequin, DTP. No. They don't break it down. Oh my God. Okay. So basically, we don't know the exact marking system, how it's going to happen.
Unless if you fail, then they'll give you a detailed
okay.
report.
So it's kind of like a subjective evaluation for all this. All
Yes.
right. Okay, understood. Next, I wanted to ask if you could give us an example of an active station, so that our viewers can, understand exactly how it goes. Any sort of an active station, if you can give us one good example with the probable questions that they would ask in the OSCE station. Yeah.
Right. Let me just see if I can give you an example. All right. There's one example on the consortium. I can give you that. Is that okay?
Yeah, that's fine.
All right. So once the circuit starts, you will read the question on the door, and it's mostly like candidate instructions. Mr. or Mrs. Green was referred to the dental hospital by his or her dentist for the extraction of caries lower left molar tooth, lower left 7. They have undergone routine restorative dentistry previously, but have never undergone an extraction. He or she is fit and healthy. Using appropriate language, tell your patient that you have come to explain his or her treatment so that the patient could give informed consent for an extraction under local anesthesia today. You are asked to give an explanation of the proposed treatment so that the patient will have enough information on which to give his or her consent to this procedure. You do not need to complete the consent form at the station. That's the question.
Okay. So there would be an actor sitting there.
After you've read this in a minute, you walk in, and then there's an actor sitting, and you start performing immediately. There is no, okay, start, no, nothing. Just perform.
Okay. So you'd have to introduce yourself. Hi, I'm Dr. Jeevita.
That's right.
And just tell me how you'd go.
Well, you say, hi, I'm Dr. Jeevita. I'm one of the dentists. I'm here to explain how the procedure is done. I understand that you're here for extraction. You've been referred by your dentist. And so these are the options. You talk about LA and how you do the procedure. The other sedation option, you discuss all the options, if not LA, even general anesthesia. And then that's how you give informed consent. So you give them all the options, basically. Then you talk about the risks and complications with the extraction. If it's lower, damage to adjacent tooth, if any, nerve injury, everything you need to talk about. Okay.
All right.
With the nerve block, inferior alveolar nerve block, the risk of permanent injury and temporary transient injury. And once you've given everything, then ask them, are you happy to consent? In most cases, they'll say yes, no, or do you have any questions? Check if they've understood everything. And then if there's a consent form, just ask them to sign on the consent form, and that's it.
Okay, great. So this sounds like how you ideally do it in our university, in our college. But I think practitioners back in India, I think we can't talk this way to the patient. They probably would get scared and not sign the consent form. But I think as we have to explain it the way we have to explain according to the guidelines and the textbooks. Right?
To be very honest, once you start practicing here, that's exactly what we do. We actually tell them all the risks and complications associated with it. So every time I do an extraction, I'm always telling them if it's an upper tooth, possibility of oroantral fistula, everything.
Quite interesting. Interesting.
Yes.
So do you have any tips for our students who want to prepare for OSCE?
Well, it's not difficult, to be honest, but it's all about staying calm.
Staying calm.
Yes.
I think, yes, and preserving your energy, I feel, man, 2.5 hours is a very long time for this, and because it's every situation different, you have to adapt to that situation. Does it happen in the morning or afternoon?
Okay, so they take about 144 candidates for part 2, and you're split into 2 groups. There's one group that goes on the first day, the second group goes on the second day. And
Okay.
each day they conduct 3 circuits. So again, each circuit will have about 20 students, plus or minus.
Okay.
Yeah.
Okay. Okay. And for preparing for OSCEs, actors and stuff, we really don't know people who can actually help us with this. Um, so, do you suggest the candidates to practice this with some of their colleagues or something? Do you have any sort of preparation guideline for an OSCE?
Yes, you will definitely need a course for this because you need to understand how the industry in the UK works.
Okay.
And it is really helpful if you have a partner who's preparing as well, or to just
Right.
practice. So one can be the actor, the other one can, yeah,
That's,
be the.
I think that's a good tip. You need to have a partner who's also preparing for OSCEs. That's going to help a lot. But luckily for us, we have Jeevita, who has been practicing in the UK, and she's cleared her ORE and aced her OSCEs, and she has a lot of simulated OSCEs with her. So she'll be training all of them who are enrolling into our ORE program with a lot of OSCE scenarios. So we're looking forward for that training, Jeevita. So probably I think we'll be starting our OSCE part 2 sometime in March or April, and part 1 would be starting in Feb. So we're very excited about it. And thanks, Jeevita, for sharing so much of your knowledge about OSCEs, and thank you for your time. Do you have anything to say?
Yeah. Well, again, as I said, it's not difficult. It's a very doable exam.
Okay.
You just have to learn to stay calm and relax. That's it.
Stay calm. I think that's a great takeaway point. Stay calm. I'll take that point seriously. Thank you, Jeevita.
You're welcome.
Thank you, viewers. Have a wonderful day. Bye bye.
Thank you for having me. Bye bye.